I am Hannah Ziegenhagen. Working with me today is Lexi Hutchison, Andrea Robinson, Catherine Mack, Elena Patton, and Jamie Sheridan. Our health promotion project is going to be focusing on blood pressure.
Our main objectives for this video are know what a blood pressure is and why a blood pressure is important to take, along with risk factors for hypertension, learn how to correctly take a blood pressure and interpret what it means, learn different ways to control blood pressure, and finally know the different places blood pressure can be obtained. So looking at what blood pressure is the pressure of blood pushing against the walls of your arteries. Arteries carry blood away from your heart to other parts of your body. Looking at how it is read, the normal range is 120/80. The top number is systolic, which measures the pressure in your arteries when your heart beats. Looking at the bottom number, this is diastolic, and this measures the pressure in your arteries when your heart rests between beats. Looking at hypertension, this is when it is above the normal range. Stage 1 hypertension is between the numbers 130 to 139, and stage 2 hypertension is when it is above 140. Now looking at why is it important to check blood pressure. Checking blood pressure is the only indicator that we have to check hypertension. Hypertension typically will not show symptoms until it is too late. By catching blood pressure early, we can reduce the risk of heart disease, heart attacks, and strokes. Some risk factors related to this is having a family history of having high blood pressure, and then people over the age of 65 will typically suffer with high blood pressure. And then looking at gender, up to age 45, more men will have high blood pressure than women, and from age 46 to 54, men and women seem to be affected equally, and after age 55, more women will have higher blood pressure than men. And the last risk factor is race, and African Americans are typically higher by 40%.
So this is how to correctly take blood pressure. Taking blood pressure is very important to reveal telltale signs of heart disease, high blood pressure, and it can potentially decrease your risk of a stroke or a heart attack. Taking it correctly is crucial for accurate results in order to see trends relating to these conditions. First off, you have to make sure that the patient's not wearing too many layers, any thick clothing, baggy clothes, or anything that's too tight. Putting the blood pressure cuff on the actual skin is the best way, so if the patient is able to roll up their sleeves or take their arm out of one sleeve, that's preferred. Secondly, make sure that you're using the right size blood pressure cuff. This is a very easy fix, but a very common mistake and a good way to get an inaccurate reading. If it's too small, your reading will be on the high side, and if it's too big, then it's going to be low. Using the lines on the outside of the cuff, you can measure to see if the arm is within the range. The line should reach the halfway point on either side of the arm. The patient should be sitting with their legs uncrossed and with their arm at heart level. You can do this with simply a table under the arm or a pillow. They should also be calm and relaxed and not talking too quickly or having just run up 3 flights of stairs to get to the appointment on time. You'll want to palpate the brachial artery to ensure correct placement of the stethoscope and make sure that the cuff is snug but not too tight or too loose. You pump it twice, the first to check the radial, for when the radial pulse goes away, and then you add 30 to that number, and then you pump it a second time until you hear the first and the last beat, and then you record the number accurately.
Blood pressure is especially important to check regularly in elderly people, and everyone over the age of 40 should get it checked annually. Kidney disease, diabetes, and obstructive sleep apnea can all elevate blood pressure, which sometimes is the first sign of these diseases. With annual blood pressure checks, diseases like these can be better regulated, and compared results can be used to catch signs of heart disease early on. So at the Senior Center, they perform blood pressure checks every Thursday. This ensures that the older population in Helena has the option of getting accurate checks on a weekly basis to promote health and safety.
Okay, so my name is Andrea, and I'm just going to be taking your blood pressure today. So can I have you put your feet flat on the ground, please? And then uncross your arms and just put your arm right here. So I'm just going to start with, can I have you flip your arm? And I'm just going to feel the brachial artery and brachial pulse. Perfect. Now I'm just going to check that this is the right size. So you can measure it here and make sure it goes halfway. Or when you're putting it on, it can wrap around to the in range area and just making sure this is pointing to the artery. Perfect. And then when you're taking blood pressure, you're going to be pumping up twice. The first time I'm going to pump up until I lose her radial pulse. And then the second time I'd be pumping up just until I don't know how to say it, until I hit the maximum inflation rate. And then you go on to listen to blood pressure. So I lost it at 110, so now I'm going to add 30 to it. I'll give your arm a second, and then we'll listen for the systolic and diastolic numbers. Okay. Okay, so I'd note just 104/72, and then just note that that is in the normal range for adults. Can I just have you lift up your arm? Okay.
So lowering your blood pressure. One way is through medications. Some of the basic ones are calcium channel blockers and ACE inhibitors. So calcium channel blockers prevent calcium from entering the smooth muscle cells of the heart and arteries. When calcium enters these cells, it causes a stronger and harder contraction. So by decreasing the calcium, the heart's contractions are not as forceful. ACE inhibitors, ACE stands for angiotensin converting enzyme, and ACE inhibitors help the body produce less angiotensin, which helps the blood vessels relax and open up. This lowers the blood pressure. Exercise, so walking, swimming, and line dancing. So get up and participate when there's line dancing going on. Exercise makes the heart stronger, and if the heart is stronger, it can pump more blood with less effort. The force on the arteries decreases, which lowers the blood pressure. And foods to eat, eating a diet rich in whole grains, fruits, vegetables, low-fat dairy products, and low-saturated fat and cholesterol products. It's also suggested to reduce your intake of sodium. And, of course, no tobacco use or smoking.
Get your blood pressure taken. There are many different places a blood pressure can be obtained. One is within the comfort of your own home using an automatic blood pressure machine or having a family member take your blood pressure correctly. Another is going to your local pharmacy, such as going to your CVS, Albertsons, or Safeway. The majority of pharmacies have an automatic blood pressure pump that you can do independently. Next, you can get your blood pressure checked at your senior center, which get tested every Thursday. And finally, when you go into your doctor's office for a visit, the nurse will take your blood pressure. Make sure to record your blood pressures with a date in order to see trends and patterns in your blood pressure. Key takeaways from this video include taking your blood pressure correctly, understanding the risk factors for high blood pressure along with different ways to manage blood pressure, and finally, the reasons behind taking your own blood pressure. Thank you for watching our health promotion video about blood pressure.